all of you. Thank you for joining us today for a landmark moment in Indian healthcare industry, marking the partnership between Apollo Hospitals and Imperial Hospital Bangladesh, bringing a ray of hope to 166 million residents of Bangladesh. It is my honor to introduce the dignitaries on stage. Our chief guest for the occasion, Professor Dr. Rabiul Husain, the founder chairman, Mr. Mohammed Abdul Malik, the board member of Imperial Hospital, our beloved founder chairman, Dr. Pratap Reddy, and the President Group Oncology and International, Mr. Dinesh Madhavan. And we have with us Mr. Reddy. I would like to extend a warm welcome to each and every one of you, including our colleagues, guests, and our friends from the media that have gathered here today to witness yet another milestone in creating access to world-class healthcare services, fulfilling our vision of touching over 1 billion lives. Apollo Group of Hospitals is consistently ranked amongst the best hospitals worldwide for providing advanced medical services with a reach of over 150 million patients from 150 countries. Imperial Hospitals Bangladesh is a 375-bedded tertiary care hospital located in the city of Chittagong. I request my colleague Dr. Gitanjali to welcome the guests with bouquets. Gitanjali, please. All good deeds commence with the lighting of the diya. Diya is an essential part of our culture because it signifies purity, goodness, good luck, and power. The presence of light means the non-existence of darkness and evil forces. I kindly request our guest of honor, Professor Dr. Rabiul Husain, the chairman, Mr. Mohammed Abdul Malik, the board member of IHL, our beloved chairman, sir, and our group president, Mr. Dinesh Madhavan, to do the honors of lighting the lamp, please.
உட்காருங்க சார் உட்காருங்க நீங்கள் சார் தலை மறைக்குது உங்கள் தலை மறைக்குது சார் தயவு செய்து கொஞ்சம் கீழே இறங்க ஹலோ கீழே 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 இது பண்ணுங்க ஹலோ புட்டாஃப்
Professor Dr. Rabiul Husain is a visionary entrepreneur who has done great work in the field of community ophthalmology in Bangladesh and has now ventured into the vision of bringing positive change in the health of Bangladeshi citizens with Imperial Hospital. May I kindly request Professor Husain to address the audiences, sir?
Good afternoon, ladies and gentlemen. I bring along with me, particularly from the Imperial Hospital, lot of goodwill yes, for the people of India, particularly the gatherings of today. Professor Reddy, the founder of Imperial Hospital, we have been sharing how he started his career in the field of service to the humanity. Apollo Hospital started his journey long time back, about 38 years back. Myself by profession is ophthalmologist. My vocation is social work. Since 1973, I have been involved in the delivery of eye care service in the rural areas of the country. So I have been working in this field for last almost 50 years. And so far, I was instrumental in making 1 million cataract surgery in the country through our 8 satellite hospitals. We have been also involved in the human resource development, particularly the training of doctors, nurses and technicians. Because without this HR, it is not possible to deliver eye care service. Now, it is a trust, eye hospital. It's a 40 years old trust, and some of our trustees are here today. They have been working with us for the last 40 years. And we felt to set up a general healthcare service in the country, particularly in Chittagong area, the second largest city of the country. So we have set up a good, beautiful healthcare service. But in order to provide service, you need assistance, particularly training of doctors, nurses, technicians. We are very happy the Apollo Hospital, Chennai, has come forward to work with us, to help us in running a hospital in a proper way, training of manpower, and technology transfer. Because we have to share our resources. Bangladesh is a new developing country. We have a lot of constraints, particularly the human resource. And we are so happy that with the leadership of Dr. Reddy and his team members, particularly Mr. Dinesh, and other team members have joined us to provide service. And we are very hopeful and we are very confident that in future we will set up a good healthcare service that will help many poor patients to provide service. It's not easy for a patient to travel abroad. So if you can give some relief to some of the patients, that will be our biggest achievement. And Dr. Reddy earlier and today also assured us to provide all his services so that we can generate a good healthcare service in Bangladesh. With very few words, I thank you very much. And we are so happy. We have been looked after very well. And thank you very much to attend this program. Thank you.
Mohammed Abdul Malik is a board member at Imperial Hospitals and he's also the editor of Chittagong's leading daily, Daily Azadi. May I kindly request Mr. Malik to address the audiences, sir?
Good afternoon to all of you. Mr. Reddy,
his team, and all the journalists from Chennai. Actually, I am really very happy because I am with this newspaper and journalism for last 62 years. My paper started in 1960, and from that onward, I am with this newspaper. And for your information, though it is my proud privilege, that this year I was awarded the second highest award of Ekushe Pradap by the state, Bangladesh, for being in the journalism. So sometimes people ask me how to get award. I said that no, award should not be the ultimate goal. Your goal should be whatever you are doing, you should do on your own and purposefully, and do something great for your people who are around you. So my newspaper is about and I have my newspaper has got another milestone, because on the 17th of December, the first newspaper came out in Bangladesh is Azadi, my newspaper. So this is the first newspaper of Bangladesh. And we gave a headline of Joy Bangla, Bangla Joy. This Joy Bangla slogan has been adopted by our present Prime Minister as our national slogan. So this is really a proud privilege for me, for our newspaper, that the government has taken one of our headline as national slogan. So this is a great thing for us. Though we are not a newspaper from capital city, but we are from Chittagong, a bit away from Dhaka, which is about 40 minutes flight. So today, actually, what we want, we have built up a magnificent hospital in Chittagong, which is known as Imperial Hospital. And actually, this Imperial word is also implies with what we have done there. But because of some technical difficulties and some short of doctors and technicians, it was not possible on our part to utilize it for the local people for which we have done it. Actually, I am the, we have got, it is a trust, the CIETC, and I am the chairman of that trust. We had Mr. Rabiul Husain, he is with this eye hospital for last 40 years, and I am also with him. And we had some money from the eye hospital. So we thought that we should do something for the local people, where actually we are short of all types of medical facilities. I myself call as a reconditioned man. Why? Actually, I have got 5 bypasses. And then I've got no gallbladder, no hernia. And I have to replace 18 of my teeth. And I have a polyp over in my nose, which I had to take away. So, this is with the God Almighty and the doctors here in this earth. I am still living. My age is 82. And I still want to live much more. Because I have seen a film, 102 Not Out. I think all of you have seen that Amitabh Bachchan. So I want to live up to 102 years. So just pray for me so that I can achieve my goal. So actually, what we look forward from the Apollo Hospital, because this Apollo itself, the name itself, is a mesmerized thing, name, because people knows all over India, Pakistan and Bangladesh that Apollo in medical science is a wonderful organization which gives all sorts of medical treatment. When I was passing through, when I arrived yesterday at the airport, there were people with lines, so I think about 10, 15 people with the name. And with a name, Apollo Hospital. So you know how much people are coming from Bangladesh every day for treatment who are here. And you know, the people of Bangladesh, as well as here in India, they are not rich, but they all suffer from same disease, from cancer, from so many diseases. So what we want from Apollo Chennai, that they should take these facilities to Chittagong with whatever we have done there and do treatment to our local people. Because this is a trust, we are not going for any sort of profit making. Though I am a director, here is so many directors are here, but we have not gone there for any sort of profit. What we want, that we should give service to others. And I am a lion, so you know, lions always, there is a slogan that where there is a need, there is a lion. So we thought that the need for the local people is in health service. So what we want from Mr. Reddy and his team, we want all these medical services so that the people, they do not have to go to India, Thailand or in Singapore. 5 days back I was in Singapore because I told you earlier that I have got 5 bypasses and every year I have to go there for just for check-up. By God Almighty, I am all right. So still, so Mr. Reddy and your team, really we are grateful because from yesterday till now and till we will be leaving tomorrow and they will be there. So the way you have looked after, we are really grateful to you for your service and everything. And I think this service will be given to our local patients also. Thank you very much. Thank you.
Good afternoon. Dignitaries on the dais of the Lord Chairman, Dr. Rabiul Husain, Mr. Malik Arshad, and other dignitaries who have come in from Bangladesh, and members of the media and the August gathering. Today is a memorable day and one like no other. June 20th will be etched for something that we have done again for Bangladesh. As you know, history stands. We were responsible for the liberation of the country, and the country went ahead and as a growth history which is in part to what happens in the South region. Now we're looking at to fill the gap of what is the need which is medically needed for Chittagong and the whole of Bangladesh for about 165 million. This envisaged project, which is to be named Apollo Imperial Hospitals, is a 375-bed hospital, a tertiary care facility in the heart of Chittagong, which will provide access to the whole of Bangladesh, not only to Chittagong, since it's a large facility to set up with an investment, I think probably the only investment by the World Bank, which is a direct investment, which speaks a lot about the vision of the Imperial Hospital board members and the chairman and the way they wanted to provide access to quality healthcare. We are highly privileged and proud that we have been chosen amongst the many who had actually approached Imperial Hospitals since they were aware about Apollo as a brand and what we provide. From July 22nd, Apollo will be operating this large facility, probably the biggest hospital infra-wise in number of beds and what it can scale up to in a sprawling 3.5-acre campus as Apollo Imperial Hospitals. What it envisages to do is to get across the border what Apollo has been doing exemplary for the last 38 years and ensure that the quality of care is second to none, the way Apollo has been doing it for the last number of decades. Patients from Bangladesh and other countries do visit us, but I think the vision of our chairman has been an Apollo everywhere and an Apollo Reach program to ensure the Apollo standard is provided no matter where it is and which clinical program needs to be delivered, that we do it consistently. We will step on the management and the brand requirements for over a 10-year program, which is what we have signed up for, which stands to be auto-renewed after that. We have a huge fiducial responsibility. I can only state that we assure the Imperial Hospital board members and others that we'll try our best. We have an exemplary team which has got an unbeatable track record, and I'm sure that you'll get to see the same delivered at Imperial Hospitals. Thank you so much.
It's another momentous day for us. In healthcare, practically every second, every moment, it's a monumental thing for and a joyous thing, because you make another man who had hopes, and when we walk into a hospital, I will get well. And I think this is what Apollo from day one said, patient first. This is another occasion when we have joined saying, Bangladesh is not new to us. It's our most friendly nation, neighboring friendly nation, and people from Bangladesh have been coming to us for a number of years, almost from the beginning of Apollo. But today, it is very special because we have a doctor, an ophthalmologist, who has created, I trust hospital of great intensity across the country and made a significant impact and made it as a trust. Then he felt, like I felt when I was a cardiologist, and I did well as a cardiologist, I said, the human being needs everything else. And beautifully, Mr. Abdul Malik very clearly said, several organs of face have been transformed. So I think a hospital, I didn't say, we need a multi-specialty hospital. I believe it's in this hotel when we announced to the media the first hospital in 1983. I'm happy that today more than 120,000 Apollo family members are serving the society, not just from the nation, from across the world. People are coming to us because they trust that Apollo today can give the same level of clinical care as the best centers anywhere in the world, but give something else which they can't buy with a juice mark or $1, the care and compassion. This is where I think if Apollo is something is special, it is not special because we are giving great surgical or medical care, but we are also giving along with it the care and compassion. This is where what I see in the chairman of Imperial Hospital, Dr. Rabiul Husain, that care and compassion that made him from an eye hospital, to build a most modern Imperial Hospital. This is what I would like to promise him, promise the people of Bangladesh, that we will have a similar hospital that's working anywhere in India. Any one of our super specialty hospitals will be with you in Chittagong, so that people not necessarily do come here. Yes, we will have exchange. Some of your good doctors will come here for doing some very major surgeries, or supporting some other facilities. And similarly, our doctors also will come there to augment the medical services that are already available there, so that people at home can get this benefit. I think that is the stress. How many people can travel? And you all know how I started Apollo. I started Apollo because I used to send the so-called president, prime ministers, and the very rich people for heart surgeries to my good friend Dr. Denton Cool. When I was a young man, leaving behind a 30-year-old wife, 4-year-old daughter, 2-year-old son, and passed away. You know why? You couldn't raise $50,000. I said, why should we spend $50,000? Indian doctors, Indian scientists, Indian engineers are far excellent overseas. Why can't we do it here? I think that is it. What Mr. Husain, Dr. Rabiul Husain has thought saying, we must provide it in Bangladesh for Bangladeshi people and for all others who can come here. We assure you, we will be with you in your efforts, and I want to assure other members of the board that all our services will be available for you to be able to give this. You know, you have seen in the past what we have done. We are doing everything that's happening anywhere in the world in practically every single discipline of this. But the future is different. The future is different challenges. The future offers different opportunities. The first big opportunities that we have is artificial intelligence, datamatics, robotics, 3D printing. Apollo has already started all these four. You know why? Because the World Bank predicted way back in 2016 that this decade is going to face a severe problem called the non-communicable diseases. But what came before this decade? A pandemic which nobody ever dreamt of. But thanks to all the public, private, healthcare setups, the governments of the various countries, it was controlled to the maximum possible benefit. So we hope the medical community will continue to work to see that the people are preserved and well. This is where I think the non-communicable diseases now is showing its face. It's rapidly increasing. Some of them are increasing between 16% to 25%. So I think we are ready. Our artificial intelligence is ready. We have already rolled it out in almost all disciplines. Our datamatics, hereafter probably when you come to a hospital, you won't take back a paper with you. But what we are not able to find is, we still need that signature. I don't know why he's going to put the signature. Except that difficulty, we are going to make it absolutely paperless. And it's available through our 24/7. To solve the 24/7. It came at a time when people are so thankful during COVID time. At any time they could call and say, I have this problem, do I have COVID? So they are already panicked. So our doctors, 6,000 of our doctors, took this call, assured them, you don't have this. And if you have, your symptoms are very minimal, you don't come into the hospital. We have taken about 5,000 hotel beds. You stay in the hotel, we will look after you in the hotel. And if necessary, take you to the hospital. So I think 24/7 came right on time, although we never expected this pandemic. It made a significant impact and earned a lot of goodwill. And now today, it's available for all people at all times, for all purposes, from medicine to diagnostics to doctors, all healthcare facilities are available through 24/7. This is what we will take to Bangladesh. You know, we will take the future. We will take what we have. We will also take, as we are developing future, we will probably develop with you some of the additional facilities that are necessary for tomorrow's health. I only want to say, I'm very, very always thankful for all the patients who trust us. Because of that trust, is our 120,000 Apollo family members who put their heart and soul when people are panicked during the pandemic. Our doctors, our nurses, our ward boy, our technologists, who are in the intensive care units, taking all that. This is service, and we promise that this service will continue forever, for better and better care. But it's not necessary that we always need to face the non-communicable diseases. You all know that way back in 1973, I started the first health checkup in the world, called the mass health checkup. Today, using artificial intelligence, you have seen that Apollo Pro Health, have just about launched it, and I think that is going to make a very significant difference in modifying the non-communicable diseases. According to me, it is the mantra which will make the change in non-communicable diseases. Before people get affected, before people come too late to us, and it's already been working. I come from a small village. 70,000 people in my village are all covered through Apollo Pro Health. And all our 120,000 family members and their spouses and their adult children have all gone through this Pro Health checkup. So we have a big data available with us. First, we are keeping our people safe and allow this mantra to work towards this huge threat of non-communicable diseases, which is supposed to be accountable for 80% of the deaths by end of the 2030, and the cost burden for the world is going to be $30 trillion, and for India, it's going to be $4 trillion. I've been pleading with my prime ministers, my finance ministers, and health ministers to increase from 1 to 3%. Why can they increase to 50% to manage their non-communicable disease? So I think the Prof Health will play a very significant role. All that I can promise is we will work together. We will work with what we know, what we can learn, what we each can give each other. And this is the only way I think we can make a significant impact. I promise again, our first promise to the nation in 1983 was saying, we will bring to our people the best possible care that's available anywhere in the world, because Indian is competent. Indian doctor, Indian scientist, Indian engineer, Indian IT, everybody is different. It's all the native of the focus and opening of the branch. Today, India has all of these. So my dream was to make India the global healthcare destination. But our Prime Minister and the government said, let's call it as Heal in India. The second big thing is the world is going to need about 30 million people in healthcare by the end of this decade. Who is going to do this? It's only countries like India and Bangladesh which can develop the doctors, the nurses, the paramedics, the managers, the researchers, and the patrons. All of these, I think, can happen in our country, and in this, I think, we'll work together with Imperial Hospital. I must again thank and congratulate Dr. Rabiul Husain for what he has done, and I would like to assure he and his board members saying, we are with you. We are one. Imperial and Apollo will be one from today, and July 22nd will be another marking day for all of us. God bless all.
டேபிள் எடுத்துடா, டேபிள் எடுக்கோ. சாரிங்க பாருங்க, சாரிங்க பாருங்க.